If you want to know the roles of a sports physical therapist in acute injury management on and off the field, you need to tune in into this episode. Before Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who heard my content in the past. If you want to know the roles of a sports physical therapist in acute injury management on and off the field, you need to tune in into this episode. Before I go on to the podcast, what is new? What is better in life? For those of you who have been following, I am staying consistent with training 7 days a week at varying intensities. So that's been great. Um, my kids are doing fantastic. My son is determining his future already. He's in between a scientist and a veterinarian. Zach is 6 years old, and already he's starting to look at what he enjoys. He currently loves animals, so it's been great to watch him grow. My son Jacob just had his first haircut. That was super emotional, and my daughter is just crushing gymnastics and soccer. Other than that, life is fantastic. With sports performance, we just announced recently that we are growing into a third location, which I'm very blessed and honored to be doing and expanding it to our community. And then we are in absolute chaos mode. All my team knows what that means. It is absolute chaos at the moment. We are recruiting, we're hiring, we're growing. So a lot of good growing pains happening at the moment. All right, on to this podcast. Why are we talking about sports physical therapists on and off the field? It's a question I get often. I think as our profession begins to grow more and more and expand into different settings, and we become more specialized, there becomes more and more questions of how do you enter a new space? How do you work with other providers? How do you become part of something bigger than just physical therapy? And what I mean by that is anytime that you're managing acute injury management, there's more people involved than just a physical therapist. For instance, there might be a physician, it could be a primary care, it could be a surgeon who is consulting with a local team, it could be an athletic trainer who is working that district or that school or that college or that pro team. And so the minute that you, as a physical therapist, start to manage more and more acute injuries, you naturally get to work with more people. You have the opportunity to work with more people. I think that's the way in your head how you should see this as you grow your skill set. It's not that you're primarily a physical therapist. We own the clinical setting. And what I mean by own is we typically we have the biggest strength, our skill set, our confidence lies on the table in the clinic, rehabbing. Now you might say, well, Chris, I can help with acute injury management and all those other things. Yeah, yeah, I'm not talking about that. I'm talking about the 80%. 80% of physical therapists have most confidence inside the walls of a clinic. Then there might be 10% to 20% who have that confidence on the field and being able to bring that into the clinic. And what I want to do in my professional career, if you ask me, like, what's my ultimate goal? One of my ultimate goals is to be able to develop the skill set of all physical therapists who want to be on that field, who want to learn more and have their hands in acute injury management. That to me is one of my biggest priorities. I want to be able to help people gain that confidence so when they do have those opportunities or they develop that skill set that they can actually use it now. And they can use it because a lot of times when you have these opportunities, you don't have too many of them. You have to be ready to party. You have to be ready to play. And when you're in front of a physician or you're working with an athletic trainer or a school director or anybody who is in a position to help you create that platform, you obviously don't want to mess up. And what I want to talk about today is how do physical therapists, what roles do we play? What hats do we wear? How do we create more of a seamless integration into a multidisciplinary clinic or a multidisciplinary team? And I know this because I've lived it and I've loved it. And I continue to mentor physical therapists who are having challenges navigating that. And most recently, I had discussions with some members of my team, and then also going through discussions and topics through my recent Sports PT Kickstarter course. And so some of the conversations that are happening are, what do I do? How do I do it? Even if I can do it, what's the best way to approach it? How do I navigate the situation? I have somebody who I want to work with, or somebody who's not working well with me. How do you do this? And so that to me is a critical portion to our expansion of our profession. So wherever you are, whether you've been practicing 20 years, 10 years, 5 years, 3 years, it really doesn't matter, because at some point you will get those opportunities, or you want to create those, and you don't want to mess up because they're very, very critical. Where I got my heaviest hands-on approach with acute injury management as a sports PT was definitely my residency. And then I was very fortunate to get a job working professional sports with the United States Olympic Committee, and working on-field coverage daily, every single day. And so everything from packing my medical kit to communicating was so essential. So let's chat about a sports physical therapist. Like, let's define what that is, right? It's not somebody who watches Instagram, videos and does really, really fancy corrective exercise, because that's not sports PT. Sports PT, and it could be you maybe you have your CSCS or an SCS. Now you're qualified to have those things. Now, what I really hope that we can as a profession do is have strength and the skill set to manage all four different domains of sports PT. The first domain is acute injury management. Number two is strength and conditioning. Number three is the sports rehab side. And number four is the injury prevention and wellness side. Now, today I just want to focus on acute injury management, because I think that's a big portion of PTs who they want it, but they're very weary of approaching those things, or they don't have all the background and training to do it. And when you look at sports PTs, I would define it as somebody who can manage all four domains with high confidence and the skill set to support that. Now, even if you're not 100%, you can still do a little bit of emergency response. And on the back end, you can still do good strength and conditioning. And then you probably own the sports rehab side. So when we talk about acute injury management, you have to know that there's a whole different evaluation process for this. And I just recently went over it, but there's three types of evaluations when you're on the field. And the first one is the primary survey. Is this person safe to stay here or not? Like, right, so they just got they just got tackled and they're on the floor, and you have to, the primary survey, are they breathing? ABCs, are they conscious or not conscious? Are they staying or are they going, basically? Once you determined that they're conscious breathing and now it's a musculoskeletal injury, perfect. That's the primary survey. You're going to take care of that. Secondary survey, you're now going to figure out, is there anything broken, dislocated, anything else? So you're just going to do, from an observation standpoint, just, is anything sticking out? Before you touch anything, you don't know if anything is dislocated, broken, fractured. You don't know these things. From there, you go into your palpation and everything else. So this is your secondary survey. First is like are they okay? They're safe to stay. Second is, can I move them and move them to off the field? Is anything fractured? So you're going to do visual inspection, observation, palpation, move everything around. If you determine that they are safe to move on their own accord and it's just a musculoskeletal injury, you can take them off the field. So on the field, are they safe to stay or go? Visual inspection, observation, palpation. It's just musculoskeletal. Let's bring them off the field. They're safe. From a sideline perspective, so that's the first one. That's an on-field evaluation. Second one is off the field evaluation. This is where you can go into everything else. This is what we call HOPS, history, observation, palpation, and special tests. This is where you're gonna go in depth. Now you can figure out, they're safe. It's just a musculoskeletal injury. You get the privilege of doing your normal exam once you've filtered out that they don't have anything major. And I think that's the scariest part, that transition. Is this something I need to be concerned about, especially if it's your first injury that you're managing, or something unfamiliar to you? Is this shoulder dislocation? Is it clavicular fracture? What do I need to be aware of? Is it a heart condition? those things are really the game-changing moments when you can determine, are they safe to move to the sidelines? Once you get into the sidelines, I don't think a lot of clinicians that have too much trouble, except your organization of your evaluation changes. So one, you have to go through that thorough history. Number two, you've got to figure out observation standpoint, what else did I miss on the field that I need to take a look at, palpation, work through all special tests, is this meniscus, ACL, MCL, whatever it is. Once you determine that, now you're like, okay, is this person safe to go back in? So primary survey, secondary survey, you're gonna do on that field, bring them off the field to that off the field of evaluation, and you're determining, can they go back in safely or not? So at every stage, you have different phases and goals. On the field, are they safe to stay or not? Off the field, can they go back in or not? Once you determine that they should not go back in, now you have a third evaluation, which is in the clinic or in the rehab setting or in the training room, because you've already determined they're out. Once they're done, they're done. So that afternoon, that evening, tomorrow, following day, you're going to do your in-depth clinical evaluation. This is where I think physical therapists aren't going to have too much of a challenge. It's now, okay, rehab this thing and move forward. I think the hardest part is that on-field evaluation and then sideline evaluation to determine should they go back in or not. Now, when you see somebody who's in your clinic 3 or 4 weeks after injury, all of that had to happen by a sports PT, an athletic trainer, or a physician, or whoever's working that sideline event to get to where they're at today. And so when you, as a clinician, you're working through, you're like, oh, rehab's so easy. Yes, but the front end work and determining if they were safe was probably the hardest thing for most people. And as a sports physical therapist, you need to be able to manage those things. You need to be able to have the confidence and skill set to determine the safety of somebody coming back. The question I get most often is, well, who's determining that? What if there's a physician? What if there's an athletic trainer? What if there's a emergency response, an ambulance, a firefighter on the field with me? Who wears what hat and when? And this is a really key component. So if you really want to get onto on the field, you have to get this in your head, and you have to have a good understanding of this. I call them hats, excuse me, or yeah, hats, that's fine. So who's wearing what hat and when on the field, it has to go by who is on your team first and foremost. Do you have a physician? Do you have an athletic trainer? Do you have ambulance nearby? Do you have firefighters on the same area? Or are you by yourself? If you're by yourself, you're wearing a lot of hats. So you now have a lot of responsibility. Now, people ask, well, Chris, what do I need to do to be on the field? What type of certification? What type of things should I have? I think there's a couple different courses and things that you should be doing. If you're going to be doing this, the first thing you should be doing is getting your certification either through the American Red Cross as a emergency responder. They have emergency responder courses. I think they're like 1 to 2 or 3 days. At the very bare minimum, you need to be taking this. Now, I think the sports PT section within the APTA also supports different emergency response courses. I think it's an ERC course or ERA course. I have no affiliation with them. I'm just offering different training courses that you can do. You can obviously do a residency. That's some people won't have that opportunity. You can study for your SES, but that still doesn't give you practical information. So you have to get this type of training in person and actually go through the skill set. Learning how to spine board, learning how to manage hip dislocation or a fracture, or lower extremity fracture, that's very key. So that way you have the basic knowledge to be able to support. If there's a physician or an athletic trainer, you have to determine, and it's all based on your state law and based on your training and everything on the front end. So there's a couple different things that I mentioned. Number one, the problem or the thing that you have to do is establish who's wearing what hat and when from the beginning. Like this is like before the game starts, before anything else starts, because the best thing you can do in emergency response is have a plan as much as possible. So the first thing you have to do is have a plan of who's wearing the hat. So you shake your hand with the athletic trainer or whoever it is, and you kind of probably already have that set up prior to, and like, hey, listen, if somebody goes down, who is managing it and when? And it depending on your state law, it'll probably be the athletic trainer. From there, it would be the physical therapist, and maybe the physician would come on afterwards if it's an emergency or anything else. Now, if you look at a pro setting, especially at the time of this recording, there was two big injuries over the last 3 weeks of the NFL, and one of them was heart condition, and the other one was, I believe, a spinal injury. And when you look at the triaging, all that's practiced on a regular basis, especially in the pro world, on a weekly basis. They are practicing, hey, what happens here? What's the scenario? And so the minute you have somebody, typically the athletic trainer will be the first, depending on the setting and how the sports team works. They'll determine if something is very critical. The physical therapist might be running with them, and then the physician will come out in the event that they need them for a secondary survey or something torn or whatever it is. So does every evaluation need to happen on the field? If it's critical, yes. If it's not, they'll typically bring them off the field. If you watch special tests being done on the field, people ask, okay, so why are they doing tests on the field when they can just bring them off the sideline? The challenge becomes is the more time you give it, the more swelling comes in, and the more apprehension that athlete has. So early, before it starts to balloon up, that is your opportunity to get a gauge on the special test. The minute that they're swelling, it's going to limit you and give you a false positive, or you won't be able to complete the test. And then they'll ask, well, when do they do diagnostics on it? X-rays, MRIs, as quickly as possible. Because once that swelling comes in, it becomes very difficult to determine what has actually happened, torn, whatever it is. So earlier the better, especially in the pro world, they'll do that. Now, if you have a high school kid, it's not a big game, and it's not super essential. They're not in the playoffs or anything else. They'll just have them on the sideline, reevaluate, and probably over the next 1 or 2 weeks get some imaging. But it's all about the resources. In the pro world, you're going to get it quickly. So what's the role of a sports PT in acute care injury management? Number one, you have to figure out that plan based on the team that is going to be present on that field or at that event. And so if you're a volunteer, you're typically going to be part of an organization or a team that has those resources. Now, if a high school coach or somebody says, hey, we need some support, we don't have anybody, one of the best things you can do is get that emergency responder course, have your CPR up to date, and be well trained and informed. That'll give you the basics and the fundamentals. Something is better than nothing. You need to be aware of that. So having those basic skill sets to be able to help out in an emergency situation is going to be better than nothing. So get yourself in a position where you can feel good about that. So have your CPR, have your emergency responder course, and then tertiary is have your liability insurance. So, I'm not giving legal advice. What I'm saying is you definitely want to have a little bit of support. People ask like, do I really need to do that? Absolutely. It takes one case to really ruin your profile and put you in a bad position. Even if you were doing a good Samaritan clause and you were trying your best and you were the only responder out there, the best thing you can do is support yourself with a little bit of liability insurance. And that's just professional liability insurance. And it's not a ton of money for physical therapists, but if you're going to be doing emergency response or response activities, it's in your best interest to invest in yourself and invest in that. So 3 things: be up to date on your CPR, have your professional liability insurance, and then take your emergency responder course. Those are the base bottom 3 that you need to have. From there, you can do all the extra training. There is some practical application that really puts you in a good position to be able to have those skill sets. And ultimately, you have to realize some people spend their entire life training for these type of things. So if you're working with an ambulance or a firefighter or anybody else, you have to understand that these individuals do it on a regular basis. Now, the way they triage is going to be a little different. Their primary thing is, are they going to live or not? They're not worried about musculoskeletal. They're like, oh my gosh, too easy. You can have it. But their big thing is, are they going into the hospital or not? The minute that they touch them and they're, having any form of spinal pain or anything else, they're going to load and go. So who wears what hat? So that is usually determined, as I mentioned, at the start. So if you have an ambulance, this is where it gets complicated. You have fire, you have ambulance, you have a physician, you have an athletic trainer, and you have a primary care and a surgeon. You're like, oh my goodness, we got a good team. It's great. Who's doing what and when? And so it might be the athletic trainer first. It might be physical therapists running with them to support. Then it's right there with the primary care physician, maybe surgeon on the field. And then from there, if it's spine boarding or anything beyond musculoskeletal and the secondary survey clears, or it's not cleared and it's something serious, then they're going to bring fire or ambulance on, depending on who is there and how they organize that. That's how usually it triages. So if you see multiple people at a site and then ambulance comes on, that's a big deal. They're typically going out for a primary survey challenge. So airway, breathing, lack of movement, spinal injury. So when you see those type of layering, that's how the triage is working. So the role of a sports physical therapist, it really depends on the medical team present. And the best thing you can do is create an action plan with everybody. Literally, I remember going to one of my first events that I went solo was during my residency, and I went to Canada with the Ohio State University's rugby team. And I traveled with them, and I don't think there was an athletic trainer with me. And so it was one of the scariest moments for me because I'm a single credentialed PT. I don't have an athletic training degree. And prior to the residency, I didn't have any on the field coverage opportunities. And so all my training was those 15 months plus the emergency response course, plus, CPR, and then just practicing with the rugby team on a weekly basis for a year. And so you develop skill sets, but there's scenarios, just like being in a clinician in the clinic, there's certain scenarios you have never seen. And then finally, after 5 or 6 years of practice, you're like, wow, I never thought I would see this, but it's in front of me. And so you can practice for all you want, but not until you see that scenario is it challenging. And I remember going with the team, and I remember packing my medical kit, and that to me was, you ever, packed for a vacation or something, and it depends on who you are. Are you an underpacker or are you an overpacker? I'm an overpacker. I will pack everything, especially in a medical response challenge. My medical kit was like 40 pounds. And I was like, oh, just in case, that maybe the just wasn't just in case. And this is the art and the science of working and managing acute injury management. It's like you never know what's going to hit you. How many band-aids do you do? What type of tape will you use? What's the supplies you might need? Do you really need the stethoscope? Do you need the blood pressure cuff? Like all these things come into play. And so when you're packing a medical kit, this is really what it comes down to is, are you prepared? And I realized I was the overpacker, and that worked for a while. And then after talking to a lot of athletic trainers and sports PTs, are like, listen, you can get away with this, you can trim this. And so I remember like reducing that just a little bit more. So the medical kit is a big part of that. So having an action plan and determining who's going to be on site, usually working with the coordinators of the event. Next is packing the medical kit, making sure you're prepared, having enough. You can be over prepared. I would take an over prepared clinician over an under prepared. So having more supplies than not, having your liability insurance set up, all your emergency response. And I remember the night before, every single night before, I'm like, okay, what happens here? What if I do this? Is my phone charged? What if the phone doesn't work? Who's going to do it? Do I have a backup phone? Where is the nearest AED? How am I going to do this? Do I have to pack my own AED? What happens if, where's the spine board? I mean, there was just so much happening. And the biggest thing I can tell you right now is figure out who's going to be there, triage the action plan, pack your medical kit, and be ready to go, and overpack if you need to. From there, think of your plan A, B, and C. If this doesn't happen, AEDs, spine boards, all those things, create those action plans. Once you do that, all you can do is be prepared in an emergency situation. That's all you can, especially if you know that there's a potential. That's all you're going to go through. And the more you go through that routine, the more you get more comfortable, and you see certain things and you're like, didn't need that, should have done that. And the more you can have mentorship of somebody behind you, that gives you so much more confidence going to any scenario. So the first thing is know your action plan, and then know who's going to be there. Create those hats early on. And so once you prepare and you have all those things, the next step is communication. So Once you do have something go on, are you the main hat? Are you the primary chef? If many of you have heard my analogies, when there's a kitchen, like commercial kitchen, there's always like the main chef, and there's like the sous chef, and then there's always everybody else who's kind of supporting. Who's the main chef when it comes down to somebody goes down? So is that you or the athletic trainer? Is it you or the ambulance? Is it you or the physician? You figured that out and you did that. Next is the over communication. I got it. I'm here. I'll give you a wave or a sign if I need you. Other than that, we're good. So if you bring somebody out, who's managing that and communicating, hey, yes, they're good to go back in, because you better believe there's a lot of athletes behind the scenes who try to go back in the game. If you have like a football team, they will tell the coach around you, hey, they said I was cleared. And that coach has so much chaos. They're like, all right, sounds good. So you need to make sure that you're delegating to the coordinator of that group, hey, coach, they're out for the rest of the game, or not cleared until I give the okay. The communication is so critical. So you've determined they're good to come off the field. You were prepared for that. You created the action plan. You were the primary. You brought them off. You communicated with the head coordinator of that organization or that team, or maybe the coach or the defensive coordinator or whoever that is. From there, you have to determine who's communicating with who, what are the yellow, green, and red lights to make sure that they're safe to go back in. If they're not going back in, that's fine. What you'll typically do is if you've determined this person's not good to go back in, you and the outside trainer have worked together, you and the physician, you and the coach, you and the ambulance, they're all good, they're just out. What you'll typically do is take the things that they need to go back in that game. So I would remember I'd take cleats. I'd take cleats, I'd take a helmet, I take whatever it is that that person needs. If it was baseball, I'll take their glove. I was taking away their primary sword, like the thing that they needed to like win or participate in their thing. Or if it's hot field hockey or hockey, take away their stick. You need to figure out what is it that they would do to try and get back in that game without your approval. So I would remove all those things, and we knew that they weren't going back in. So I communicated, but I also removed the potential barrier that was going to happen. So that's the hardest part. The easy part is now they're in the clinic and they're in a safe environment. You've determined that. And now you're in the rehab process. And now it's your time to figure out how soon before they can go back in. That's the next biggest challenge. First one is, are they safe to go? Are they safe to stay? Are they safe to go back in or not? And then the clinic, how soon can they go back in without reducing their risk of re-injury? And this is the art that a lot of sports PTs will be challenged with. So the role of a sports physical therapist is to work with the team early on, communicate effectively throughout that process, and safely get them into the clinic. From there, determine quickly how soon before they can return to play. And if you've worked in orthopedics, traditional orthopedics, you typically don't see somebody until like maybe 4 weeks post-injury, typically. And your timeline to get them back to whatever they want is based on their preference or whatever it is. But the challenge where sports PTs come about is when they have to come back, when they need to get back within a week or 2 or 3 or 4. Because you've had this luxury of time, it becomes even more challenging to like squeeze that in together. You're like, well, that's not going to work. In sports, there's ideal and there's enough. So you got to figure out what do you need in order for them to get back in. You better believe in the pro world, in the pro setting, enough participates in the game, especially when there's a lot of money riding on it. Ideal is nice, but it's so rare. What you don't see is how many people are banged up leading up to that game who have adrenaline, maybe have some additional anti-inflammatories in them that were injected right before the game. There's just a lot of things that we don't see as a consumer. And you better believe that they're not healthy all season long. Impossible. The likelihood is like 0%. So what you need to do is, as a sports PT, your role is to figure how good or how close to enough or perfect or ideal are they, and what's safe to go back in. Now, that is the fine line in the sports PT world. When you go from acute injury management and you're like, you don't have enough time and you're like, gosh, I wouldn't throw you back in, but coach, and you want to go back in, it's like, gosh, I just need to make sure you're safe enough to go back in. Is this ankle going to have a problem? Is this shoulder dislocation going to be enough? Do they have 4 weeks? What's ideal? The imaging said this, physician said this, coach wants this. That's the art and the science, and that's where the communication comes about, and the confidence with making those decisions. And so, number one, figure out the organization who wears the hat, create the action plan, make sure you're communicating amongst that whole rehab process, determine what is ideal, and then when's enough. And that'll help you with pushing and pulling and knowing when to pause. But ultimately, knowing the spectrum before they hit the clinic, and then once they hit the clinic, how do you get them back over the bridge when they have enough to be safe? That all sounds pretty straightforward, really simple. The challenge is when it's in front of your face and you have all these people looking at you, the pressure is on and you will make mistakes. I think that that's a normal part of the process within sports PT. And your goal, honestly, if you're a type A OCD type of a sports PT, which a lot of people are, especially that's why you get in this industry, you've been successful, you've been at the top of your class, you've been able to get through a lot of things and become very successful in your life, and you're like, well, I don't want to be wrong, I don't want to be. And the reality is, in sports PT, there's going to be a lot of challenges you're not familiar with, and all you can do is give your best approach with all the information you have and create the plan based off of that. There's a potential that you're about 80% right. That 20% is a risk, but that's the challenge of sports PT, and that's the challenge of acute injury management, that you're under pressure and there's ideal, and that doesn't always happen, and you have to be okay with that. And my wife and I have discussions about this all the time. My wife, Stephanie, is a physical therapist and athletic trainer. And we used to do events together, high trauma, action sports, BMX, big collisions, big trauma. And I enjoyed it. And she would tell you to this day that she doesn't enjoy it anymore. That's a lot of pressure when somebody's looking at you and saying, hey, are we spine boarding or are they getting up? That's a hard call. And if you're too conservative, the reality is you get plagued by, like, you get a name, they're like, no, don't let that guy, don't invite him to the next event, right? Like, all they do is want to pull out athletes, and organizers and the coaches, they realize that. They're like, oh, how conservative, like, are they going to pull all my players out? Even though you think you're doing a good job, there's a hard balance, because you have the medical ethos, or the decision to, like, do no harm, make sure the athlete's safe. But the reality is that the coach and the organizer or the director or the owner of a company or the owner of a sports team has a different financial lens, and you're caught in the middle. And unfortunately, sometimes your job is at jeopardy. And this is a hard call as a sports physical therapist. That's why I'm saying there's ideal, and in the clinic you can set that, because if they don't have a timeline, you're like, oh yeah, we can do, let's do 10 weeks, maybe 16. What do you feel like, Mrs. Jones, right? Like, there's no pressure. And so on the acute injury management side, you better believe there's pressure. And so the role of a sports physical therapist in acute injury management is so many hats. There's so much pressure. And if that excites you, I think that's great. Like, go for it. Continue to advance your skill set in those. Get those courses. Put yourself in those positions. If you don't enjoy it, I would say just have enough of a basic skill set in the event that does happen. Then be ready for it. But if you don't want to push in that direction, don't. But for those who do, there's a huge opportunity for you. There's a lot of athletic trainers, physicians who can use the support. You just got to know what hat you're wearing and your state law to make sure that you're put up in a good position, that you're safe, and that you have a lower risk of liability, and that you can still play a part in supporting somebody and making sure that your local community, maybe you work in an area where it's not as heavily populated, and you can be that primary person. So if that drives you, these are the things that'll set you up for success. If you're asking for, like, well, Chris, what other ways is there for you to gain that confidence and skill set? That's ultimately why I've created my own programs. That's why I've done this. I've seen a gap. There's a lot of physical therapists who have that passion, who want it, but where else do you get it? And where do you get the blend of, yeah, you can do the emergency response. Yes, you can do the CPR, but what about the gap that happens from on the field to the clinic? And then how do you get them back? And so that gap is really where I'm trying to help support. I want to fill that gap. And I created my sports PT accelerator course so that any sports PT who is managing acute injuries or wanted to manage acute injuries, what is a step-by-step process to bring them back in? And once they're in, how do you quickly get them back out? Everything as a sports clinician, all you talk about is, rehab to performance, rehab to performance. What if it's on the field to the clinic and back? That's a whole different spectrum, not like the weight room and sport. I'm talking about acute injury management in short time and come back. So that gap, there's a gap in there. So for those of you who are interested, at the time of the recording, I have this scheduled for, I think, March 18th and 19th of 2023. This is a in-person and hybrid virtual option. So if you are across the country, this is a great opportunity for you. If you're in San Diego or if you're going to fly to San Diego, come hang out with me and my team for a weekend on acute injury management. And ultimately, so you can fill that gap of the 4 domains: acute injury management, sports rehab, strength conditioning, and the injury prevention and wellness. Once you do that, you're in a good position that you can manage any athlete across any timeline and ultimately see yourself as a true sports PT, not just a sports rehab expert, but the whole spectrum to be able to manage an athlete at any given stage. You do that, I promise you, your career opportunities improve, your profile improves, your fulfillment improves, everything about what you do just continues to get heightened. And I know it because I see it. I've mentored thousands of physical therapists who have that confidence because of it. So if that's of interest to you, go ahead and go on to my website, drchrisgarcia.com/accelerator. If not, I will see you guys on the next episode. I hope you guys are doing amazing, living your best life, and staying healthy. All right. I will see you guys on the next episode. Take care.